Hello and welcome to this lecture. Today we are going to discuss type and goal of antimicrobial therapy. And there are five different kind of antimicrobial therapy, such as it could be used as prophylaxis, it could be used as preemptive, it could be used as empiric, it could be used as definitive, it could be used as suppressive. And we mentioned in this table that when it is given as prophylaxis, at that time there will be no infection. Then preemptive is just like that infection just started but there is no symptoms. Then in the empiric case the symptoms have started. In the definitive case, that we confirm the pathogen, we come that which microorganism caused that disease. Then suppressive, we try to solve that problem. So this is a cycle of the types and different goals of antimicrobial therapy. So when we talk about prophylactic therapy, there is no infection at the time. As I already discussed about anti-malarial drug proguanil that has been given before the malaria for travelers, especially for traveling to wildlife. And the goal is to prevent the infection of a potentially dangerous disease in patient. Especially they're talking about sometime target treatment at use. When we talk about preemptive, it about after infection that has been occur, and this is the early detection of the patient that are having a high risk. For example, they're not symptomatic, they are asymptomatic, but they are infected patient. So we talk about preemptive therapy. To understand that preemptive therapy in simple terms, not in case of the microorganisms, or you can say not in terms of the bacterial infection, but in terms of the viral infection. Like for example, in case of COVID-19, there are people that are asymptomatic at that time, they having no symptoms. So in that cases, the patient under COVID-19 with no symptoms, they may be infected, we started preemptive therapy. So is a perfect example in case of COVID-19, that no asymptomatic patient having no symptom but are having at high risk, maybe they contact with person that are infected with COVID-19. We start with preemptive therapy, so you can memorize or understand with in context of COVID-19 patient. Then we have empirical therapy in the symptomatic patient. We know the symptoms patient having, but we don't know which microorganism it having. But I already tell you that in common practices in underdeveloping countries, in poor countries, or even in Malaysia, I have seen that nobody tests with which microorganisms. They don't culture them. They just see the environment and then they give the antibiotics. So empirical therapy is like the patient having symptoms, but the problem is that the diagnosis is not definite. It's just like that we don't know which microorganism or which causative organism it caused that infection. So the problem is that we give antimicrobial, but if the organisms susceptible drugs, like for example we give gram positive uh, drugs for the treatment of gram positive bacteria, but maybe it is we need to give drugs for gram negative bacteria, then it could be cause some toxic effect and may promote resistance, as I mentioned in this slide in this point. And the examination of infected, we can see that we need to see the secretions of the body fluid. We need to do culture in the microbiology lab to identify which microorganism it could be possible. Then definitive therapy, we know the pathogen, we already narrowed down them, we already cultured them, we know that it is maybe caused because of E. coli, streptococci, staphylococci, or which type of microorganisms. And then we give the single drug monotherapy to reduce the risk of the bacterial infection and toxicity and resistance, especially. And we start with the single drug, and then we take a look on, we observe the patient whether they get benefit. Usually the definitive pathogen, if we know them, we can able to treat a patient in a better way and reduce the microbial resistance. Then we have post treatment suppressive therapy, and this is that if for example the infection is not controlled completely or completely eradicated, if the infection persistent, then we give post treatment suppressive therapy, usually for given for the AIDS patient or for a patient having post transplant, but they are having risk of toxicity because of the long term use, because long term use can cause inflammation in the liver, can cause hepatitis, or can cause jaundice, and can disrupt the immune system as well. So the post treatment suppressive therapy could be given in patient that are having and the disease, long-term diseases like AIDS, or patient having post-transplant. So thank you so much for today's lecture. Hope to see you again in our upcoming lectures.